Everyone. I am very happy to be here. Thank you for inviting me. I came with resistance. I was invited on an email and my first thought was that I'm really tired of talking about equity, which this is an equity conference, right? We're talking about health disparities. But I respect the work of Michelle and I respect the work of Amy. And I decided to come. One of the motivating factors was this may be one of my last chances to be able to make an address like this. I'm moving, I've resigned. I'm Miss JayVon, the CEO of Marin City Health and Wellness Center, but I have resigned from that position. My last day will be December 21st, and I will be going to Louisiana. So it really did motivate me to come because I have a few things that I would like to say. I have been blessed to be able to be over amazing programs like the birth center that you've seen, like the school and the children that have just talked to you about their experience. I want to say that I stand here today on the shoulders of my mother, who was a crack addict. She was a victim of a state-sponsored program to infiltrate her community with crack cocaine that happened to Black people across the country. I want to say that I stand on the shoulders of my grandmother, who was a maid in Corte Madera in her 20s, Bernice Watkins, Marlena Watkins. I stand on the shoulders of my great-grandmother, Molly Berry, whose mother was a slave, and I was blessed to have her in my life until my 20s. I stand on the shoulders of my grandfather, Bill Watkins, who is a white man, and who had enough love and respect for me to take me for a portion of my life while my mother struggled, and to give me great messaging that allowed me to be able to compete. How many in here know what everyone knows Halloween? We'll just make that assumption. How many know Dia de los Muertos? How many have ever heard of Fete Getty? You did. So there's a couple of hands here. The response that I saw from the audience, I want you to know that that is how it feels to be Black in America. I heard over and over and over today that we are a nation of immigrants. But I have to tell you that all of us didn't get here the same. Our immigration looked a little different. And that has to be said before I move forward in this conversation. Because we enter November, and as part of African traditional religion, or part of African tradition, we enter into a celebration of our ancestors, but you don't know that. Because little is known about the African in America that descends from enslaved people. And so for the portion of this conversation that I move forward in, I'm not talking about immigration, because Black people have immigrated here, right? There are Jamaican immigrants, there are African. I'm talking about the African that was here, that had nowhere to go, and that was a descendant of an enslaved person who cannot stop right now and speak another language to a person that's standing next to them, who cannot be tied by culture that they were able to hang on to. It feels some kind of way to be Black in America, and this specific kind of Black. And I need you to hear that, because today we were celebrating Binational Week, and we can't really participate in that, but everyone said, or most people who spoke said that we're a nation of immigrants. But we can't celebrate Binational Week. We don't have any ties like that. We have the ties that we've made for ourselves. And that feels horrible because we're dwindling in parts of the population in the Bay Area. That feels horrible. I rock with Latinos, and I know that immigration is bigger than Latinos, but that's how we're feeling today. I rock with revolutionary Latinos because I only support people who support me. Because someone said, the sisters that did the presentation earlier said that, Myra said that they never do anything alone. But if you're African American here, you have to learn how to do things alone, because we are rarely supported. What's supported is resources, right? So today, my babies that I had come here because I said, you got to get in this conversation because it's about equity. asked me, why are we here when we haven't been mentioned at all? Until Dr. Willis came up. Imagine feeling like that at an equity conference, because that's what I came to speak about today. So I want to have a conversation with my family. Who in here considers himself a leader in the Latino community? This is a conversation that we are going to have intimately, and then we're going to have greater. Because I lead a clinic. I was at a needs assessment meeting last week, and this has been on my mind for a week. I was at a needs assessment meeting where leadership from clinics came around a table to talk about the needs moving forward in Marin County. Because this meeting, the hospitals put on this kind of survey, and it influences where community benefits funds go. Well, hell, I didn't want to go to that meeting either, because we've been punished by Marin General Hospital for the last few years because of a decision we made to open the birth center, and we haven't really benefited off of community benefits funds. So I went with resistance. But I went, and now I want to paint the picture, because out of all of the healthcare leadership, no one in the room was Latino. No one. And I came kicking and screaming. I had to stop in the middle of the meeting because the entire meeting was about the needs of undocumented immigrants. Now, I felt a little strange because I rock with undocumented immigrants. I don't have an issue with immigration. I believe it's enough land for everybody, and I support indigenous people coming back to get the land. But how can you sit in a needs meeting in Marin and not realize that Marin City is still there? And there's a group of black people who are there who have been there, and they are documented. They have been there, and for decades, their ancestors and their elders have been fighting for rights here. And the civil rights that they fought for are the rights that we get to talk about today when we look at Section 8 and all of the wonderful things that were said, but not many people mention that today. And that's the story of being black in America, because as the conversation shifts to our Latino family and more resources go that way because there are more people, that's logical, right? We're talking about 25% of the population versus 2. We need you to stand with us in the same way that you ask us to stand with you when we talk about sanctuary cities and DACA and everything else that we line up with, because it's part of being in this weird category called people of color, when you don't really get any benefit when you're 2% of the people of color. And that's not hate, like this is family business. Because as we support you, you gotta come support us. Because you're standing on the shoulders of my grandmother, who was a maid in Corder Madera Bernice Watkins, who was there with the cheap labor before the evil strategy was being developed to use you for cheap labor. Because this little mob that they call it coming from Guatemala has nothing to do with people loving immigrants. It has everything to do with America needing cheap labor and the machine that needs to keep going. And we get so confused with things. If you love people, then you want them to get all that they deserve, right? I want them to get all that they deserve. I actually think that we should be trying to give them that without having to come here and lose everything. That's a real conversation for me. But since we won't have that, we have to figure out how to look out for each other. And as the Latino population grows and the African American population dwindles, you can't overlook them, because then you're doing the same thing that white people have done to us forever. To come and have a conversation about equity and not be mentioned when we sit at the bottom of all those statistics is not fair. As I leave here, I would like to ask, spoke with Dr. Colfax last week, and I told him one of my greatest concerns was that I'm leaving, and I feel like we won't be able to address things like that. So I'm leaving, I'm delivering that to all of you, because black people are not only hated by white people in America. There has been a global attack on black people, even within your communities. I know. I wanted the Mexican representative to be here. I went to medical school in Universidad Xochicalco in Ensenada. If you know me and you follow me on social media, my little 7-month-old Nana is half Salvadoran. I'll be in El Salvador this month. We struggle to survive every population. Every population across the planet, black people are at the bottom because there has been a global campaign to criminalize us since the beginning, to take value from us in darker skin. We don't only suffer here. So what I'm asking my family to do is remember that. As you get more power, remember that. Give us justice, even within your community. Do that. And then we will have equity, because no matter where you come from, we still stay at the bottom. Now, I created that birth center because we die more. We had the privilege of taking care of a Guatemalan woman, Kiki, maybe 6 months ago, who came into our birth center, and we were so excited to have her because we created that partly for her, because I do really believe in equity. And she came in and we were able to treat her like a human, treat her family like a human, get her a birth certificate without 1 million people in there in her business making her feel unsafe, and take excellent good care of this sister. She came back for her 3-day visit and she was so excited because the family that she worked for, because she was a nanny, said she could come back to work right away with her baby in tow. And I was pissed, but I couldn't show her that because people got to do what they have to do. But the point is, we can't say that we're looking out, we're supporting people only to use them for free labor. Across the board, we have to take care of each other across the board. And as we become 2% of the population, and maybe even 1%, remember that we're still there. And the people that you're overlooking are the people who lived there, moved there, and couldn't move because the county redlined them. These are people who couldn't leave Marin City. They had to stay in Marin City. These are people who are sick because they had bad food. These are people who are sick because they didn't have access to medicine, but they marched. And they got those things not only for themselves, but for all of us. See, because if it was about equity, we could fix Marin City right away. Why should they have access to any food but good food? It's nothing to send only good food into a community of 3,000 people. It's nothing to make an educational system that will serve 3,000, less than 3,000, just nothing. If we really wanted equity, this is a rich county. It's ridiculous. Ever since I came here 6 years ago, I've been seeing that stupid slide of Ross versus Marin City. It's nothing if we care to send resources to a community of 3,000 people, but we don't care. That's it. They said Marin was the highest performing with the greatest disparity. We don't care. We have the money. We have the money to build houses. We have all of that. We don't have the will. And so the Democratic people in here, I'm asking you to help us have the will. Well, you have the will because we're 2%.